to be hearing from Dr. Bijul Patel. He's a member of the Valpo and Nephrology Medical Group here in San Diego for 10 years. He's been the lead nephrologist for Sharp-Free-Sealy, who is celebrating their first president ever tonight. Kind of fits the theme. And has been involved in population health management for SRS and dialysis patients, and supervises one of the largest home dialysis programs in the country. He's an active member of a whole host of things inside Sharp. He's on a lot of really cool boards. And graduated summa cum laude from Penn, and has consistently been voted one of San Diego's top docs. Balloting closes soon, I think, right? Better hurry up and make sure you vote for Dr. Patel. He's certainly been a strong advocate for patients and physicians. In his own words, he has 3 above-average children. And has been married to his wife, Rena, for 15 years, and I quote, most of them happily. He considers himself quite the joke maker, his words not, and an avid Pittsburgh sports fan. I give you Dr. Bijul Patel.
Thank you very much to the San Diego County Medical Society for allowing me to share my story here. I want to thank Dr. Hertzka for a great introduction I wrote. And Dr. Mihir Parikh for a wonderful year advocating for physicians in our San Diego community. And also, congratulations to Dr. Sorensen, who I think will do a terrific job this coming year. Kind of annoying to lean over, but okay. This is my story. I call it Sick as a Doc. On Monday, January 7th, 2013, I was seeing patients and I started to have flu-like symptoms. I spent the night fielding many pages and phone calls about sick patients. I drove in the next morning with multiple layers of clothing, heat on full blast with my teeth chattering. After a difficult morning seeing patients, I was trying to find my strength to see my clinic patients that afternoon when one of the hospitalists convinced me that canceling patients was not about me, but about my patients who didn't want to get sick either. I went home to rest. I started having fevers, diarrhea, headache. The next day, I again canceled my patients, something I'd never done before. That night, my wife, Rena, told me I need to see a doctor. Luckily, I was a doctor. The next day, I continued to have fevers. I felt off balance and could not even walk without holding onto the walls. That night, my wife found me on the floor of the shower. I was so weak. What do you think you're doing? I've got to go see some patients. I've canceled so many, I can't let them down. She told me she was calling 911. As confused as I was, I told her to take me to Sharp Memorial, where I'd been working for the prior 6 years. In the ER, a bunch of blood tests, a lumbar puncture, a CAT scan were done. I had poor kidney function, viral meningitis, and signs of severe inflammation, but no exact diagnosis. The night was kind of a blur. Within a few hours, Friday morning arrived, and now I was on call for the weekend. I texted my partners. Fortunately or unfortunately, I've been admitted to 5 West with a sodium of 123, a creatinine of 2.9, and a C-reactive protein of 457. I don't think I'll be able to work this weekend. Sorry for the late notice. I still have that on my phone. My partner quickly ran to my bedside and transferred me to the ICU. That day, I did my best to die. That's not funny. My heart had signs of damage with ST elevation and a troponin of 6, with the echocardiograms showing spiraling systolic function. My fever would not go below 104. My blood pressure kept dropping. More and more doctors kept on visiting me, trying to secure a diagnosis. I got ultrasounds, CAT scans, MRIs. By early Saturday morning, there was an extreme sense of urgency, as all the doctors gathered with my wife to explain how bad I was doing. My partner figuratively slapped me in the face, and if you know her, you know what I'm talking about, and told me, Bijal, you're dying even with all our treatments. Your kidneys are not working, your heart is failing, and we think as a last effort we should open up your leg to see if there's an infection. The anesthesiologist from ASMG came to my side and told me I was going to die without the surgery, and that I had a high chance of dying on the table during surgery. I started to cry. It was the first time I actually grasped what had been happening to me. I begged him, please don't let me die. My parents arrived later that day from Pittsburgh, and they saw me for the first time in months. I was on the ventilator with multiple tubes and lines. It's still hard for me to think about what they must have been feeling at that moment. After 3 surgeries, 4 days on the ventilator, I woke up from a medically induced coma and remember thinking, I am alive. I was diagnosed with streptococcal toxic shock syndrome, with myositis and necrotizing fasciitis. Most people die with the illness, and many don't know the diagnosis until it's too late. It's so rare that most doctors don't recognize it. The few that live often lose limbs. I spent a total of 20 days in the hospital. It was 3 months before I could walk again, and 1 year before I could actually come back to work full time. Relationships saved my life. Each and every person I came across during my illness was equally important in getting me better. And for that, I am grateful. Thank you to the ICU nurses who cared for me tirelessly, knowing my every desire when I couldn't speak. The doctors who acted upon their duty and oath, they worked day and night, collaborating with each other, making sure I never took my last breath. The floor nurses who became my family, holding my hand through the toughest times, and making sure I was comfortable. Nutrition services who made ordering food something to look forward to, offering a glimpse of some control in the craziness. Thank you to the concierges who welcomed my family to a place they did not want to be. The physical therapists who strengthened my limp body, holding me up when I could not even stand on my own 2 feet. The Arts for Healing program, Reikiing my headache away and letting me create bedazzled picture frames for my kids when they couldn't see me. Thank you to the transporter whose whistling on my way to radiology made my pain a little less. The janitors who made sure I slept in a clean room and every day asked me how I was doing. The chaplain, my physician colleagues, my friends, and my family who helped recruit a higher power. Relationships eased my fears. What I'm most grateful for is how each person took care of my family when I couldn't. You comforted my wife, Rena, with eye contact and constant updates. My parents were in awe of the buzz of my care team, working so hard to beat the odds I was given. My 2 brothers, a doctor and a pharmacist, and my sister-in-law, a nurse, we're treated as an active part of my care team, yet we're spared the burden of choice in my treatments. You supported them by listening, handing out hugs, and shedding some tears. How can I repay you? As a patient, every second of every hour of every day, I carried the fear of the unknown. Would I lose everything I'd worked for? That's debilitating. That's scary. Relationships strengthen my will. As I recovered over 3.5 years, you helped me find my strength. Unfortunately, or fortunately, I caught a glimpse of chronic illness. Through that time, you were my cheerleaders, you were my coaches, and you will always be my heroes. It was only until I came back to work when my recovery advanced. Perspective is an amazing gift. I felt lucky to be able to take call again. It made me feel whole again. That faded fast. We know how difficult it is taking care of people. Many of our patients have a fraction of what we have, and some have no one else in their life but us. Caring for patients is a complex task requiring diligence, coordination, and communication, and we do it with pride, grace, and kindness. As a physician, never forget how significant you are in the life of our patients, nurses, and staff. Each action you take creates many ripples which can inspire or destroy the will of a patient. Let's make sure we are cohesive, collaborative, and supportive of each other. How else can we fulfill our mission? As physicians, we are some of the most privileged people on earth. Not all of us started this way, yet sometimes we forget all the fortunes we have gained or been afforded. It is a tragedy that not all physicians are happy. Create situations which are mutually beneficial. Learn about your patients' lives, their family, their wishes. Building their story makes your encounters more effective, more honest, and more rewarding. We have an empathy gap in America, and healthcare is no different. As physicians, we don't always know what it's like to be a patient. But most people also don't know what it's like to be a physician. With so many forces pulling at us, there will be times when we may struggle at work. We can find comfort in spending a few more minutes reducing the fear of a patient, or educating the family with an extra phone call, or even asking a fellow physician, how are you feeling? Experience this difference. Giving, sharing, and treating others with respect and kindness better serves our purpose and increases our resilience. It is a powerful cure to our own struggles. Today, I ask you to remember to be kind to yourself. Each time we see a patient, it does take a little piece of us. Remember, the opposite of self-care is self-neglect. Make time for yourself. Hike a mountain. Learn an instrument. Take your birthday off. Get a massage. Prioritize sleep. We need to be aware of compassion fatigue and how it can hinder our mission. There is a looming public health crisis that involves the mental well-being of our physicians. Does anyone really want their physician to be burnt out? Don't be afraid to speak up. Don't be afraid to recruit help. Sometimes we need help. We sure as heck deserve it. The health of our society depends on us. Thanks to the enormous efforts of the San Diego County Medical Society and the California Medical Association for fighting for the health of our community by ensuring the proper environment for our doctors and for our patients, it is nice to know someone has our back. I imagine a day when even most healthcare administrators ask physicians, what can I do to help you help our patients? As our task becomes more difficult, we must continue to fight for the health of patients and our physicians. I live to tell you to keep on listening, to keep on caring, to keep on connecting. Connections give us hope, comfort, and joy. Connect with your neighbor, connect with your staff, connect with your primary doctor, connect with your patient. And never underestimate the power in making someone feel significant. It will save a life. It can give someone new life. It may one day even save your life. Thank you for allowing me to share my story, yet I truly believe this is our story. As a patient, as a doctor, as a fellow human being, I honor you. Thank you.